Welcome back to the session on euthanasia in rodents. So, as I said earlier, it's a very important aspect to give a clean death to the animal that you were handling. And the idea behind the entire procedure of euthanasia is to end the life of the animal with the least amount of pain and distress. So, last time we have gone through all the general methods of euthanasia, what are the different types of euthanasia, and we covered the preliminary aspects of the carbon dioxide asphyxiation method of euthanasia, which is the most preferred method of euthanasia. All right. So, today we will go through the details of how exactly the carbon dioxide asphyxiation euthanasia is performed, what are the do's and don'ts, and how to ensure that the death is clean with the least amount of pain and distress. All right. So, let us look at the technique per se. It's very important, as I said earlier, carbon dioxide being heavier than air, incomplete filling is very common, and rats can escape by avoiding coming in contact with the carbon dioxide. If the chamber is bigger and your flow rate is inadequate and the concentration is inadequate. So, to ensure that the dosage of carbon dioxide is good, you will have to follow certain principles based on the size of the cage and the flow rate. So, these two parameters are very important to ensure that the size is appropriate and your flow rate also becomes appropriate to the size of the euthanasia chamber that you are using. All right. So, these are some of the prefixed or pre-calculated flow rate which is appropriate for the given size. All right. And these are the different types of mice, and you are having different sizes, and accordingly the flow rates are readily available and given here. All right. So, if suppose the size of the chamber differs, how will you determine the flow rate? So, that's an important aspect of today's discussion, because we need to ensure the flow rate is appropriate for the chamber size. All right. So, if a standard size cage is not used, the flow rate needs to be calculated using the formula below. So, this calculation usually provides 50% displacement, anywhere from 30 to 70% is permitted. That is, you are displacing the air in the euthanasia chamber and replacing it with carbon dioxide. So, the range of that displacement should be anywhere from 30 to 70% to achieve the end result of euthanasia. All right. So, how will you calculate the flow rate that is required to maintain this displacement? So, you will be getting the length, width and height of the cage, all right, and that is in inches. So, once you do that calculation, you will get total cubic inches. This is for the cage that you are using it for euthanasia, or in other words, this is the euthanasia chamber size, all right. Then you have a conversion of 1 liter is equal to 61.02 cubic inches. So, by dividing the total cubic inches of the euthanasia chamber by this 61 cubic inches, you will get cage size in liters. So, it is a simple conversion of cubic inches into liters, so that you will calculate the flow rate. So, then you will see the displacement of 50% of cage volume per minute is your target. So, then you multiply this cage size, which is in liters, by 50%, that would give you flow rate. I guess this last line is not really visible in the screen, but I guess, so this is what it means. So, you need to get 50% of the cage volume with carbon dioxide. So, to do that, you multiply the cage size in liters with 50%, you will get the final flow rate. So, it is very important to determine this, and even if it is a prefix, it is always good to cross check and ensure that appropriate flow rate is used to get the appropriate corresponding displacement rate, which should be within the range of 30 to 70%. Alright. So, how exactly that you are going to deal with the carbon dioxide asphyxiation technique. So, here you will be handling the carbon dioxide cylinders. Alright. It is very important that you familiarize yourself with the different parts of the carbon dioxide cylinder, then the job becomes easier. It is good that carbon dioxide is easily available from the commercially available with all these prefixed volume, and all you have to do is to calculate the flow rate and then use these given knobs, adjust it with the appropriate flow rate, and the job is done. So, that hence there is of course a learning curve that goes through this technique, but once mastered, euthanasia becomes smooth, and hence this particular method is the most preferred method for euthanasia. So, what you are seeing here is the knob to open or close the carbon dioxide cylinder to let the carbon dioxide come out of the cylinder. Alright. Once that comes, then you have a regulator volume in the cylinder to get the regulator to finally get into the outlet of this cylinder, wherein you have adjustment of the flow meter. So, this flow rate which you have calculated will be taken across using this knob, and the flow rate is adjusted. Alright. So, but before that you need to ensure that the rat is transferred from the housing cage to the euthanasia room or the euthanasia chamber. As I said, the same housing where it has other living rats should be avoided. Alright. So, the only special consideration that we covered last time was the infection, to contain the infection within it. So, you will not transfer it to the other room. Except for that condition, all the other scenarios you will be transferring it to the euthanasia chamber. Then the personnel will check the carbon dioxide level in the carbon dioxide cylinder. That is very important. Before you actually begin the procedure, that level has to be checked. If the same cylinder has been used past many times, then your entire attempt is going to be futile, and with the inadequate flow rate, the rat is going to be in significant distress. Alright. So, check the carbon dioxide level in the carbon dioxide cylinder before opening the gas delivery valve and tubing from the carbon dioxide cylinder, which is attached to the chamber lid. Alright. So, before we do that, we need to ensure that the cylinder is full and it is available for euthanasia. So, these are some of the pre-checks that you need to do it. So, as I said earlier, animal will be placed in the euthanasia chamber and the lid on top of the chamber will be closed, and you need to ensure that there are no air leaks happening in that particular chamber. And then the gas delivery pressure will be adjusted to 20 to 30 psi, that is here. That is very important. To ensure a smooth flow rate that you are going to adjust in this, you need to adjust the pressure first to 20 to 30 psi, which is neither too low or not too high. Alright. Once you do that, then animals are slowly exposed to the increasing level of carbon dioxide by turning the flow meter on, that is this. Alright. First you open this, second is this 20 to 30 psi, then your flow rate will be adjusted in the valve knob that is given here. Alright. So many liters per minute will be adjusted in this. Okay. And then that is the final flow rate, wherein rate of 2 to 4 liter per minute for mice and 8 to 10 liter per minute for rats. That is the recommended flow rate, and of course, you will be calculating the flow rate by yourself by measuring the chamber size if it is different from the standard sizes. Then you are supposed to allow the gas to fill the chamber at a rate plus displacement rate of 30 to 70% chamber as I said earlier, or cage volume per minute as per the calculation that we have done. And it is very important to ensure the holding capacity of the chamber. If you all remember that number of mice or rats in the given chamber is very important if you are planning to use it for more than one animal, alright. So, the recommended holding capacity is 5 mice per cage, alright. That again depends on the size of the cage and then the flow rate that you are going to use, but generally not more than 5 mice is allowed. For rats it is different. You can use 2 per cage if the weight of the rat is less than 500 grams, alright. If it is more than 500 grams, it has to be 1 per cage, alright. For rats it is different. Animals exposed to carbon dioxide for at least 3 minutes or longer if necessary until the animal stops breathing. So, that is the exposure time, 2 to 3 minutes. Okay. So, once the animal falls unconscious, the flow shall be increased for an additional 2 minutes, alright. Then only you are trying to turn the valve off, because unconscious does not mean death. Okay. So, to ensure the cessation of breathing and stoppage of the heartbeat, we are trying to give additional 2 minutes before you even open the euthanasia chamber, alright, before you turn off the carbon dioxide delivery valve. So, before you do that, you need to give additional 2 minutes, that will be around 3 plus 2 5 minutes procedure, alright, if it is for rat. So, animal should be exposed until complete cessation of breathing. Only then the rat will be removed from the chamber to assess the vitals. So, it is going to be a visual monitoring. If you have the facility where the respiratory rate, all that can be monitored within this euthanasia chamber, that is well and good, but generally that is not required, which is an expensive setup. You can observe the breathing visually because it is a glass chamber, and once the breathing stops, only then you will be removing the rat from the chamber. So, and the death must be verified by assurance of the cessation of respiratory and cardiovascular movements by observation at room air for at least 10 minutes. So, once you remove the rat from the chamber, this is what you are going to do. You need to observe for an additional 10 minutes, alright. If suppose the exposure is inadequate and the rat is recovering, you will be able to make out within that duration of 10 minutes, alright. So, it is very important that respiratory and cardiovascular movements should be 0 at the end of your exposure. Or there are secondary method of euthanasia that you will be employing based on your project objectives or your protocol objectives, wherein cervical dislocation, decapitation, exsanguination performed will ensure that the death is complete and the cessation of these respiratory and cardiovascular movements are complete. So, that is another way of doing it. However, these are definitely not recommended for all the scenarios. So, the only method which is recommended is carbon dioxide asphyxiation, and you need to ensure that the rat is dead. So, if you are not employing any of those secondary methods which I just mentioned, it can be found out and it can be confirmed by these criteria, alright. And the combination of criteria is what is preferred: lack of pulse, breathing, corneal reflex, and response to the firm toe pinch. If you all know, the toe pinch causes the rat to withdraw, it is called withdrawal reflex, that should be absent, and of course breathing and the corneal reflex. Corneal reflex is checked by bringing a wisp of cotton onto its cornea, then the rat blinks. That is one way of looking at it. But the breathing and lack of pulse using the vital monitoring system is a very good method of confirming the death. And stethoscope, hearing the respiratory sounds and heartbeat is another luxury that you can add if you have the facility. And of course, other indirect method is graying of mucous membrane, and rigor mortis is a very important um, parameter which will confirm the death of animal. So, none of these signs alone except rigor mortis confirms death. That is very important. If there is rigor mortis 100%, that means the rat is dead. However, if there are no rigor mortis, then you have to use these combination of signs to confirm the death. So, this is what is the crux of the today's session. Basically, you need to ensure there is death which is with the least amount of pain and distress, alright. And if carbon dioxide asphyxiation is the only method that you are going to use, then you need to use all these criteria to confirm the death of this animal. So, of course, heartbeat is another thing that you can assess, which needs to be assessed for 5 minutes or more, whereas the condition called bradycardia, if it is only a momentary check, you might miss the long pause between the two heartbeats. That is the reason why we need to assess it for a longer time, and the best assessment is through direct palpation of either the pulse in the carotid or femoral artery or direct cardiac palpation. You can feel the chest of the animal, or you can feel the carotid or the femoral in the neck or in the hip region. So, either you feel the pulse or you feel the heartbeat over the chest. These are the ways where you can assess the cardiorespiratory functions. And if at all you still have doubt what is happening to it, then thorax can be open and the heart should be exposed and viewed directly or palpated to confirm the lack of activity. This is another layer of confirmatory finding, and of course, thorax is open if the rat is lying supine. This is the rat, this is the tail, and that is the mouth. So, you can feel the rib cage. You will be picking up the skin and make the skin incision that way, and then the tip of the sternum will be held upwards, and then the cut will be given laterally to open the thoracic cavity. You will see the diaphragm and the abdominal organs below, and once you lift up the rib cage, the heart will be seen directly. That is one way of confirming. Another way of confirming, arterial pulses small may be difficult to palpate, so direct inspection of cardiac mechanical activity is necessary, alright. And hence the reason why usually euthanasia is followed by organ harvesting. Not only it confirms the death, and it also allows for your histopathological analysis, alright. So, these are the other methods, and another sophisticated method is of course by looking at the ECG monitor if you have vital monitoring system. So, these are the different ways of confirming the death of euthanized animal. And other way is the central nervous system sign is by looking at the pupillary response to light. When you shine the light, the iris constricts, and if there is no constriction of light, then definitely the brain is not functional and it is brain dead, alright. And then you will see the respiratory pattern. So, profoundly anesthetized animal may exhibit shallow irregular breathing pattern that may be confused for lack of spontaneous breathing. If suppose you are doing an euthanasia following your acute surgery, wherein you have done a procedure and you want to euthanize a rat, if you just look at the respiratory pattern which is really shallow, you may even miss that the rat is still alive, because if it is a shallow breathing, you may not really appreciate the thoracic and abdominal movements that are happening. So, that is another caveat if you just depend on the respiratory pattern. That is the reason why you end up in using multiple signs, alright, to confirm the death. So, once that is done, you need to, once the rat dies and you remove the rat, and you need to clean the euthanasia chamber in between the euthanasia of different animals. So, and it is very important, and how we are going to dispose this carcass of the animal after organ harvesting. You need to ensure that there is a designated area for the disposal using the trash bag that is provided, and then the animal facility disposal guidelines has to be followed, because it is very dangerous if it comes in contact with the research personnel in any form. And then we need to ensure that the area of this euthanasia is cleaned up appropriately. All right. So that's about the carbon dioxide asphyxiation technique. Briefly about physical methods, which generally not preferred, so I am not going to too much of details into it. As I said, you will be using it only when you think there is going to be interference with the study protocols. For example, you are trying to study a drug which might get altered by the presence of carbon dioxide in the system, and if you want to really look at the concentration of particular drug in the organ, then if that concentration going to get varied by the carbon dioxide asphyxiation technique, only then you are trying to use these kind of techniques which are not really preferred otherwise. So cervical dislocation has been used for euthanasia, and when performed by well trained individual, it appears to be humane and is followed in rats which is weighing less than 200 grams, not for bigger animals. And in the mice, after animal is unconscious either by inhalation of carbon dioxide gas or by injectable anesthetics. Before employing these physical methods, generally you might use these ancillary techniques to employ the physical method. The animal should be, and how it is done is that animal should be placed on the surface by holding the tail. Thumb and index finger are placed on either side of the neck as shown here at the base of the skull. Alternatively, instead of using thumb and index finger, you can use a rod or scalpel to press at the base of the skull as shown here. And on the other hand, the base of the tail of the hind limb is quickly pulled in that direction. So there is a traction and counter traction. Then there is this is the skull, foramen magnum, and then your vertebral column. If you remember the anatomy, you are trying to dislocate the skull from the spinal column. So it's a bit of a disturbing thing to do, but then if it's rightly done, the death is really quick. This motion separates the cervical vertebra from the skull and causes a rapid loss of consciousness. All right. So once you pull it, it definitely causes the separation, and then there is instantaneous death. That's the technique of cervical dislocation. And another least preferred technique is decapitation, wherein it involves the severing of the neck. Obviously, that is the body, and the head will be put into the guillotine space here. So this decapitation is carried out using guillotines designed specifically for the purpose to ensure rapid and quick severance in the correct position. Is used primarily when pharmacological agents, as I said, is used and carbon dioxide are contraindicated. Only then such methods are indicated. I think cervical dislocation is preferred than decapitation. All right. And then what is the adjunctive methods? Exsanguination can be used to ensure death subsequent to stunning or otherwise unconscious animal. If you remember, these are the secondary methods to ensure the death. If the primary death, if you have any doubt whether the animal is dead or not, only then you will be using such methods. As anxiety is associated with extreme hypovolemia, exsanguination is never performed as a sole means of euthanasia, and it is always secondary method because it causes extreme anxiety because of hypovolemic shock. So exsanguination is basically withdrawing the blood from the body. All right. So how is it done? So maybe exsanguinated to get blood products, but only when sedated, stunned or anesthetized. Okay. Withdrawal of large blood volume, that is exactly what exsanguination means. That can ensure death of an animal and prevent resuscitation. So typically this would require removal of at least 25% of animal's calculated blood volume. Only then it ensures death due to hypovolemia, that is reduced blood volume, which will cause circulatory arrest. Alright, due to reduced stroke volume of the heart. Heart suffers ischemia and it stops. Alright, the heart itself requires blood and oxygenation. In the hypovolemia, the supply to the heart muscle itself comes down and the motor pump stops. So, that is the circulatory arrest due to hypovolemia. So, this is another method of confirmation of the death. So, that ends today's session. So, we have covered all the various techniques of euthanasia. So, we have gone through different methods, the advantages and disadvantages, and we have gone through in detail about carbon dioxide asphyxiation, which is the most preferred method of euthanasia. In next few sessions, we will try and see how the organs are harvested. So, since this is mostly a neural engineering project, I will be discussing only about the harvesting of brain and the spinal cord, how you need to ensure that brain structure is maintained for further histopathological analysis by doing a clean organ harvesting. It is very important that you know the steps correctly in order to maintain that jelly like structure intact. Alright. For example, you probably would have used an implant and you need to maintain that trajectory for the implant, and you need to confirm it by doing an histopathological analysis. It is very important that you maintain the entire structure of the brain while you harvest it. So, that harvest follows euthanasia. So, that we will consider it in the next session. So, thank you all for the kind attention.